Good morning, everyone. And today in rheumatology, a very short topic. It's basically not short, but from rheumatological point of view, like you are going to study this osteoarthritis in surgery, for example. So maybe you will study in more detail. But in rheumatology, um, just to talk about something in which basically we are not going to look anything in the bloods, or rather, it's a condition which is of the old age basically, and there is you can say uh, deterioration or destruction of the joints, okay, and we call it as osteoarthritis. If you remember in the previous lecture, I show you the difference between uh, the inflammatory and degenerative condition. So actually we don't just have to talk one condition which is a degenerative condition. So I choose this topic as a starter, and easy, short, and not complicated. So by definition, you can say what is osteoarthritis. So if I will talk about the definition of osteoarthritis, so simply it's a progressive deterior- deterioration of articular cartilage, okay, and surrounding tissue structures caused by genetic, metabolic, and biochemical factors with secondary components of inflammation. So remember this thing, the inflammation is secondary to many other factors, right? So this is a quite simple definition of you can say osteoarthritis, right? Um, the importance of this topic is simply because it is the most common form of arthritis which is seen in the primary care, and the as I told you, you will find most of the people of old age. So simply the incidence increases as the age increases, and many of them they become disabled, or they had some sort of disability. Disable is not a correct word, rather you can say they have some sort of disability. um, One of the thing, like almost everyone over the age of 65 shows some features of osteoarthritis on imagings, okay, but just few of them they are symptomatic. Now actually, the preface of this thing is I already covered in the previous lecture. If you want to know about what I'm talking about, is to then go and see what are the differences between inflammatory and degenerative type of conditions. So what are the causes of this thing? It could be primary, which is the, or you can say idiopathic. It is the most common one. We don't know the etiology, and it could be secondary, which is like less common than primary one, but it could be post-traumatic, or you can say mechanical causes, or post-inflammatory. Uh, so, for example, the people who have rheumatoid arthritis who may have this thing, or someone who have septic arthritis, infection in the joint, and later on they have this thing. Some of them they have endocrinal disorders, okay, like acromegaly, and some of them they have metabolic um, disorders like gout, and some of them they have neuropathic type of disorder. If you know, like in diabetes, I talk about Charcot joint, which is a deformative arthropathy, like the joint become completely deformed. So you can see like Charcot joint how it looks like. So uh, any of these causes are there, but remember the most common cause is the primary one. Now, just to show you the stages over here. See, um, like this one is like you can see um, the osteoarthritis stage. See, stage 2 is mild, and stage 3 is moderate, and stage 4, like see the cartilages completely, the articular cartilages a lot destroyed. Uh, so of course, like there are many biochemical factors. Some of them, they found like there is increased cytokines. Some of them they found like the destruction of the tissue is basically going at more rate than the repair of that tissue, and many of the contributing factors, but like it is not well understood like how they are playing role, like because for example they found that the people who have knocked knees, they have more osteoarthritis, but how they don't know. uh, Sometimes it is secondary due to joint injuries or uh, some specific occupation. We call it as occupational osteoarthritis as well, but like no need to specify right now it as a different thing. So simply, it is very 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 common type of arthropathy, the most common one. Okay, and increases with age simply, and most of the cases they found like genetic predisposition. Okay, so old people, obesity plays role, female have more, and trauma also play a role. Now, a few of the things uh, which are important to now know is simply when the people they have osteoarthritis, you can see over here. Of course, like this will cover your clinical features as well. You can see like the hand of this person who have osteoarthritis, right? So what you can see over here is simply this man have see, these are his DIPs or distal interphalangeal joints. These are the PIPs or proximal interphalangeal joints. So see, you can see due to this osteoarthritis, they have the nodes. The one which is at the distal one, they are also called as Herberden nodes. And what is below them is basically osteophytes. And uh, when they have nodes on the proximal one, they are also called as Bouchard's nodes, Bouchard nodes, Bouchards, Bouchard's nodes. These are Herberner nodes, these are Bouchard nodes. Uh, okay, so uh, different people they have different uh, joint involvement. For example, um, the most commonly uh, Uh, and osteoarthritis, by the way, it is most of the time asymmetrical, except in knee joints, because whenever the knee joints are affected, they are usually symmetrical. Both of the knee joints, they are affected. So in the hands, they can involve the DIP, the PIP, the carpometacarpal joints, and a metacarpophalangeal joint. This one, and this one. So all these joints can be involved. Simply, it can involve the hip joint. It can involve the foot, especially the first metatarsophalangeal joint. It can involve the lumbar spine. It can involve the cervical spine. So osteoarthritis can involve any joint. Okay, but uh, like you can see over here, he have like the nodes, right? And of course, like looks like an old person. So simply, guys, like whenever anyone have osteoarthritis, how they present with is clinical features of osteoarthritis is simply they present with joint pain, which is the most important presentation, right? So they have joint pain, and if you remember, I told you the difference is um, the joint pain comes more towards the end of the day or the PM pains. Okay, like in inflammatory conditions, it is more in the morning. Morning stiffness is there. Okay, they can present with morning stiffness, but like less than half an hour, right? So short duration of, you can say, morning stiffness is there. uh, so the most important thing is joint pain, and the joint pain, like the characteristics. Joint pains is like the aggravating and relieving factor will ask. So joint pain comes with activity, right? So of course, like when they wake up in the morning and they keep on moving, so during the evening or afternoon times their pain started increasing. So and this one is improved with rest. So one day once they are going to rest their joint, they feel relief of pain. Morning stiffness will be there, but it is usually less than 30 minutes, right? Or half hour. So morning stiffness is not so prolonged. Now, so the most common thing is pain. And when you will examine, of course, the joint, you will find the tenderness. Okay. So on examination, of course, there will be tenderness. And that's why I wrote, clinical features so that uh, I can talk about symptoms and signs randomly. Okay. Uh, Now, see, this is very, very, very important. Now, depending on the joint which is involved, like they can complain of anything like joint locking, like when they wanted to move their knee, it get locked or things like this. Okay, uh, they can complain of joint locking. They can, if for example the osteoarthritis is very severe, maybe you would like they will found. Uh, they complain of some joint instability or you can say decreased range of motion. Okay, so can be decreased range of motion. Okay, and of course when you will examine, of course you can found the tenderness, you can found the joint swelling, you can found the redness, okay, or erythema, you can found the redness, you can found limited range of motion. Okay, when you will try to move them, there will be limited range of motion. And what like you can found crepitus. When you will move the joint, you can hear the crepitus inside in that. And you can found anything like a deformation. Okay, deformation can be there of the joint, deformation of the joint can be there, deformation or you can say joint um, malalignment. Okay, so you can found like any of these things on examination. So of course, like I show you this thing, and I told you like any of the joint can be involved. It could involve the hand joints, DIP, PIPs, CMCs, or MCP, or metacarpophalangeal, or all these things. Okay, it can involve the hip joint, it can involve the knee joint, it can involve the metatarsophalangeal joint, it can involve the uh, cervical spine, the lumbar spine. Okay, uh, less commonly it involves the ankle or shoulder joint or elbow joint. Okay, or MCPs. MCPs are also less common, not so common. Uh, so MCPs are less common, ankles are less common, shoulders are less common. Okay, uh, so all the things they can be involved. Now there are some secondary abnormalities. For example, see the joints are swelled. Okay, the joints look swelling is there. They look big. So of course, like these patients may have some nerve compression or nerve neuropathic type of pains. It could be the presentation. Okay, uh, not so common, but of course they can present. And of course, like it depends on what kind of joints are involved. For example, if the knee joints are involved, the pain will be around the knee joint. If the hip joint is involved, the pain will be in the groin, and there will be decreased range of motion at the hip joint. The first of the motions which are movements which are lost in case of hip joint is the internal rotation and the abduction. Okay, so these things can be there. So anyhow, the important thing is to do the investigations. And now, talking about the investigations, I will show you how it looks like on X-ray, for example. This one is of course X-ray of a knee joint, right? So see, this one is the normal knee, and this one is like the arthritic knee joint. See the joint space over here, and see the joint space over here, and see the contour of the cartilage over here and see it is all destroyed, right? And you can see the bony spurs not so clearly in this one, but you can see over here, right? So uh, now the best test you can say to diagnose osteoarthritis is of course imaging or radiographic test, joint narrowing, or you can found all these things, osteophytes or these cartilage problems you can see. But of course, it is diagnosed on X-ray. But the thing is, uh, we can do other investigations to rule out other causes. For example, uh, and these are also called as the hallmark findings. Joint space narrowing and subchondral sclerosis, or there's something called a subchondral cyst or osteophytes. These are the hallmark changes of this thing. So okay, what I was talking about, like investigation, of course imagings are the one which is used for diagnosis, but other investigations are basically to rule out other causes, like you will do rheumatoid factor to rule out rheumatoid arthritis, or anti-neutrophilic antibodies, or CBC, or ESR, or CRP, or for example you can take the synovial fluid from the joint to rule out septic arthritis. So the investigations are simply to rule out, to look for any other cause, okay, which is playing the role in these patients. Uh, Regarding the treatment for osteoarthritis, is many, you can see, of course, like we have to manage this condition, right? So you can see over here, osteoarthritis, oral medications, injectables, devices or braces, lifestyle modifications. Uh, remove this thing. Let me remove this thing. Lifestyle modifications or interventions, and complementary or alternative medications which we use. Okay, I will talk about this thing, and topical medications, of course. Now, guys, there is no treatment like this, which can alter or decrease the progression or decrease the course of the condition. So, uh, of course, we tell them to modify their lifestyle. Of course, what is the modifications they need to do is to, um, of course, weight management things. If the patient is overweight, you can ask the patient to bring their weight in the normal values. Like if the BMI is high, so you will ask the patient to lose their weight. Okay, try to do exercise which they can bear easily, but of course don't uh, do weight bearing exercises. For example, if the knee joints are involved, don't play sports like football or things like this, of course. Or you can say prevent any type of these kind of sports which can of course cause injuries, okay, or which can cause further injury. uh, like that thing is important. Uh, the most important thing I told you, these patients, they complain of pain, right? So this thing, now exercise plays a very important thing, as well as the weight reduction, because the patients who reduce weight and bring their weight in the normal BMI, they have less, they report of less pain, uh, as well as they report of improve in the range of the motion and decrease in the stiffness of the joint as well. So simply we can ask these things, these kind of uh, lifestyle modification in the patients. Okay, so moderate exercise is very 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 good for this one, and normally the WHO says like you must do at least 3 times week per week exercises and have to produce some sweat. But like in this one, of course, we can refer them for the physiotherapist, or we can tell them, for example, to um, like the physiotherapist tell them some special exercises, which they can do. Swimming is very good in for these patients, of course, but because swimming there is no weight in any what you can say joint of the body. Okay, so whenever they want to do some aerobic exercise, swimming is very 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 good. And then there are exercises to uh, uh, you can say increase their range of motion. Okay, things like this. So simply, like, they can, of course, like they are told by the physiotherapist. Now, um, physiotherapy, other than weight loss, um, talking about the devices and braces, for example, we can give them some splints or braces, or if you have seen, like, the old people, uh, if like, arthritis is very um, common cause of fall in elderly people when they have pain in some joints. So, like when they are walking, suddenly there's pain, so they can trip over, they can fall down. And of course, fall is bad because they may cause head injuries. So, especially in old people, uh, we can give them some braces. If you will see that stick, the cane stick which they use for walk. So, of course, like that cane is a type of brace or aid which help them in walking. So, different splints or different uh, braces or devices are available. They are also called as assistive devices. So, there are different orthotics are also available for them. Okay. Other than that, um, the most common presentation in these patients is, of course, pain, and we have to control their pain. I would rather tell you, if you want to control or if you want to know about the painkiller, go and study and read about the WHO letter of pain, because in these patients, we use the same oral medications. We start from acetaminophen or NSAIDs. Of course, if they have neuropathic pains, we give them drugs like amitriptyline or antidepressants or antiepileptic, carbamazepine, pregabalin or gabalin, drugs like this. But when their pain is less, we start from first line drugs like simple painkillers like acetaminophen and NSAIDs. They are the ones which are given. And if the pain is not controlled, of course, we keep on increasing changing the drug. Uh, like other drugs can be used, which are like codeine, combination analgesics like acetaminophen with codeine, things like this. So depending on how much pain they have, we can give them those medications. Talking about the so talking about see the topical medications. Now there are different type of topical preparations are also available, like Rumagel, or they have NSAIDs that, so they can apply locally, and of course, like there will be no systemic side effects for these drugs. There are some transdermal opioid patches are also available for these patients. So these can be given. Then comes the game of injectables. Now, when we talk about injectables, guys, there are different type of injectables. For example, uh, there is intra-articular steroids, corticosteroid injections. Okay, so which are useful in acute flare-up of this condition. So, or intra-articular hyaluronic acid injections can be given as well. So we can give corticosteroids as injectables. They are effective in short-term treatment, and hyaluronic acid have some evidence of long-term benefits in these patients. Uh, so there are many studies. I don't want to talk about the studies right now, but they found in many studies that like hyaluronic acid is effective in osteoarthritis in long term. They don't give any short-term relief. Short-term relief is given by corticosteroid injections in the joint. Okay. Other than that, like talking about the surgeries now, uh, surgeries are not written over here, but one of the remedy like is surgery as well. Of course, like when the thing cannot be dealt medically, then we can go for surgery like Osteotomy can be done, or joint replacement, knee joint replacement or hip joint replacement. Sometimes, for example, they can fuse the joints as well, especially in lumbar or cervical region. What they do, like they fix the joint is immovable. So when you don't do the joint, move the joint, of course, there is no pain. So surgeries can be done as well in these patients. Okay, so uh, we consider surgeries, especially when the patient have pain and functional impairment, and you have tried all the medications, of course. So then we can go for total joint arthroplasty or osteotomy type of surgeries in the patients. Uh, Other than that, what is left? Um, Alternative medications, okay? Complementary or alternative medications. Now, in the market, there are many products are available. For example, there is glucosamine or uh, chondroitin uh, things are also available. There are special oils which are available. One of the thing is called as acupuncture. Now, I know one thing, that nice guidelines, for the back pain. Nice guidelines are UK guidelines, and they talk the things like this, that which treatment have grade A evidence, which are like clearly beneficial, and then grade B evidence, grade C, like this. So they include acupuncture as a treatment for back pain in the people in which like the back pain is not treatable. They say like we can use for go for acupuncture. uh, there is one thing called as electrostimulation technique TENS, uh, which is like, if you see, like they do some treatment with the giving some wave therapy, and there are many claims, by different companies, like this thing is available. Some are doing electromagnetic therapy and things like this. So all these things, so they are basically called as complementary or alternative medicine. So basically, like if the patients they believe in that, we cannot stop them. So in the market, I was talking about, there are different kind of oils are available. Avocado oil, or different type of special preparations are available. One of the thing is called as glucosamine and chondroitin. uh, Now there is no clear studies which establish the effect of these things, okay? But like, if the patient wanted to try, of course we don't stop them, so they can try these things as well. So this is how we go for osteoarthritis treatment, uh, starting from lifestyle modifications, then go on the medications, topical as well as oral, and then go for the injectables, okay? And if injectables are not working, uh, then we can go for surgery like arthroplasty or osteotomy or joint debridement. So all the things could be done in the patients, okay? uh, so that's all. Joint replacement surgeries are quite what you can say, um, successful, as well as uh, they are more or less very, you can say, like knee joint replacement or hip joint replacement are like too many people they go for it, like in their old age, simply. So thank you so much, guys, for listening. That's all for this osteoarthritis, and my next lecture will be about rheumatoid arthritis, which is a very, very, very important topic. So thank you so much, and we'll see you in the next lecture.